This is a demonstration for the checklist for sterile wound irrigation and wet to dry dressing change. First, Sam will check the medical record for the healthcare provider's order prescription for irrigation and the type of solution to be used.
Okay.
Assess pain and administer pain medications 30 minutes prior to the procedure, if necessary.
Are you having any pain? Okay, I'm going to give her some morphine 30 minutes before.
Okay. Warm the irrigation solution, approximately to body temperature. Identify the client using 2 client identifiers.
Can I get your name and date of birth? Check the wristband, it matches up.
Provide privacy. Raise the bed to working height.
Okay.
And perform hand hygiene. Place the client in a comfortable position that provides easy access to the wound and will allow the irrigation solution to flow freely from the wound with the assistance of gravity. Keep the client covered and expose only the wound. Position a waterproof pad to protect the bedding from any runoff. Position emesis basin in the bottom of the wound to collect irrigation runoff. Place a garbage or waterproof bag for the soiled dressing nearby. Perform hand hygiene if necessary. Apply clean gloves. You may also apply a gown and face or goggles if you suspect there may be splashing of body substances. Remove the soiled dressing, noting the type of dressing that were on the wound. At this time, observe the type and amount of drainage on the soiled dressing and also note the appearance of the wound. Do measurements, size, type of tissue at the wound bed, drainage, odor, depth, tunneling, or undermining.
So I took off an ABD, dry gauze, and as I take this out, I see a small amount of serosynchronous drainage. In the wound, I see bone showing some granulation tissue, and then I'm going to check for, I'm going to do my measurements. I'll say the width is about 5.5 centimeters by 5.5 centimeters. Check the depth. I will go with the deepest point, and I'm gonna say that's about 1 centimeter. I'm gonna go around and I see there's a tunnel at 2 o'clock, and that's about 3 centimeters. There's also a tunnel at 9 o'clock, and that's about 2.5 centimeters. And I also see undermining like around the whole wound. Okay.
Dispose of the soiled dressings and the gloves. Perform hand hygiene. Chart your findings, which Sam verbalized her findings, so that would be her charting her findings.
Yes.
Perform hand hygiene and set up a sterile field on a clean, dry surface. Add sterile supplies to the sterile field.
So, and all we have to add is the ABD.
The ABD. Notice how her hand is covering the sterile area so she's not too contaminated.
Add my solution. This has never been opened, so I don't have to lip it.
Okay. Fill sterile cup with solution for irrigation as she did, and then you'll have your 35 ml syringe and your cotton swab as well as your angio catheter ready to go on the tray. Apply sterile gloves. Notice how Sam is not turning her back to her sterile field. Now that her sterile gloves are placed, we're going to irrigate the wound. So fill the 35 ml syringe with sterile irrigation solution, which you had previously poured. Holding the angiocatheter tip 1 inch from the wound bed, gently irrigate the wound with a back and forth motion, moving from the superior aspect to the inferior aspect. Repeat the irrigation until the solution runs clear. Pat the skin surrounding the wound edges dry with sterile gauze, maintaining sterility of your gloves. Wring out excess moisture from a 4x4 piece of gauze and unfold. Using a sterile cotton swab and/or forceps, apply a single layer of the gauze to the wound bed until all surfaces are in contact with the gauze. Notice how she's keeping her gloves sterile. Be sure that the gauze does not touch the surrounding skin. Apply a dry gauze and cover the wound with a sterile ABD pad. Secure the dressing with tape or Montgomery straps. At this point, your gloves are no longer sterile. Dispose of supplies and gloves and perform hand hygiene. On a label or piece of tape on the dressing, mark in ink, not marker, the date and time that the dressing was applied. Assist the client to a comfortable position, put side rails up, bed to lowest position, collate within reach, and assess the patient's pain level.
Mr. Collate, are you having any pain?
Nope. Document and record the irrigation performed, type and amount of dressing used, how the patient tolerated the procedure, including the pain and comfort. Report any brisk, bright red bleeding, sharp increase in pain, retention of irrigant, evidence of wound dehiscence, or excavation. The signs of shock to the healthcare provider immediately.